I'm originally from Roswell, Georgia, north of Atlanta. I've been in Macon now 15 years, which is the longest I've ever lived in one place, so I guess I'm officially a Maconite. After completing high school in Atlanta, I went to college at the University of Virginia. So I'm currently celebrating the basketball national championship my school brought home just a month or two ago. Came back to Atlanta and went to medical school at Emory University, where I met my wife, who is from Macon. She was in my medical school class, and that's one of the primary reasons I'm here in Macon, is I married a Macon girl. Went back to the University of Virginia after completing my orthopedic residency and did an additional year of training at the University of Virginia, specializing in sports medicine, which is primarily the treatment of conditions involving the shoulder, the knee, and to a lesser extent elbows and ankles. And after that extra year of training, came back to Macon and have been here ever since. I think I knew early on in medical school that I wanted to do something surgical. There's just a very challenging and pleasing combination of the academic and intellectual aspects of being a physician, with the information you have to learn and the ongoing accumulation of information from new research that you need to stay current on. But blending that intellectual part with the physical part, being able to take your hands and just physically repair and fix something that's broken down or injured in the human body. It's just a nice combination of skills, the intellectual and the physical part. So that led me to wanting to be a surgeon. And then as I rotated through the different surgical specialties in residency, it just became quite clear that orthopedics was the one that intrigued me the most. It's very satisfying, again, to take a broken bone or a torn ligament or an arthritic joint and be able to use the skills you've accumulated through many long years of training to repair and to restore function to those injured body parts. I played sports when I was young, so I think that was another feature that led to me wanting to be in a field of medicine where I got to be around sports, athletic competition, being a team physician. It's very satisfying to help injured athletes get back to being able to participate in the sports that they love to do after suffering an injury. So I think all those kind of led me to becoming a surgeon, and in particular an orthopedic surgeon. I married a Macon girl and came down to Georgia wanting to come back to my home state after finishing my training, and had a number of different interviews around the state, Atlanta, a couple different interviews in middle Georgia, and just really felt like the physicians that I met here and interviewed with were just genuine good people. It just felt like a safe place to come, felt like a place I would come and be treated fairly and with mutual respect, and I haven't been disappointed at all. The partners that I joined when I came here and the subsequent partners that we've added on, I think to an individual are just good quality human beings that enjoy being involved in a positive way in the lives of their patients. I have 3 daughters, 2 of which are currently in college. One is coming up on her senior year in high school, and we like to travel, and my girls have all been involved in sports growing up, and I've coached their various softball teams and basketball teams. My wife is a physician. We met in medical school, and she is an internal medicine doctor, so she helps me on countless occasions to understand some of the complex medical problems that my patients may have. So she's an in-home consultant that I frequently turn to, and I think she helps me to be a better physician. I think it's tremendously important, the level of confidence I had after that extra year of training up at the University of Virginia, working with the the two primary team physicians for the University of Virginia sports teams. Just that experience and that extra volume of seeing patients in clinic and being involved in complex state-of-the-art surgeries, it just brought me to a whole new level of feeling self-sufficient as a orthopedic surgeon, as a sports medicine surgeon. So absolutely, that was one of the best decisions I've ever made, to invest that extra year of training. I would estimate that I do surgery on probably less than 10% of the people that I see in my clinic. So there are a wide array of treatments that we have available to treat painful conditions of joints, of athletic injuries, of almost the entire spectrum of orthopedic problems. So that is certainly something I would want patients to understand, is that when you come into my office to see me, surgery is only going to be discussed if that's the only way to get you better. If there are safer, less invasive ways to treat you that have a reasonable chance of success, that's absolutely what we're going to start with, and we'll reserve surgery for the last resort. If you have a problem that clearly non-operative treatment is unlikely to be successful in resolving, then I certainly will communicate that to you and discuss surgical options. I think it's impressive, the group we've compiled here, and if you walk through the office and look at the different diplomas that are hanging on the walls, you're going to see University of Virginia's, you're going to see Harvard University, you're going to see Emory University. There's just a tremendous amount of education and training from all over the country. So what that has allowed us to do is to compile multiple different backgrounds and approaches to how to treat orthopedic problems. It allows us to share with each other what we've learned in our various pathways of training, and it's just such a good community. And we have such a wealth of knowledge from such vast different backgrounds and academic institutions that I really think we have, for being a relatively small town, not as big by any stretch as Atlanta. I really think we've compiled just a really talented and capable group to take care of orthopedic problems in this community.